Welcome to a very special edition of Medical News Network, your trusted source for the latest advancements in the medical and dental field, making your life better. I'm Mike Wiggenstein, and thanks for joining us. Today we brought our cameras to Chicago, Illinois, to the Willis Tower, formerly known as the Sears Tower, to the offices of Dr. Alan Moses, to learn a little bit about sleep apnea and snoring, the stopping of breathing while you sleep that's now known to cause high blood pressure, heart attacks, a wealth of issues, and TMJ, or the dysfunction of the jaw joint that's been related to headaches, migraines, neck pain, back pain, and a wealth of other things. So if you toss and turn at night, don't sleep well, wake up more tired than you went to sleep, or just are generally not feeling in good health, my advice, sit back, get comfortable, and we'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're in the offices of Dr. Alan Moses in Chicago, Illinois. First of all, Doctor, I want to say thank you for letting me bring the camera and crew out today and taking your time to explain to us a little bit about sleep apnea and TMJ. I asked you to have a few patients come out so we could hear from them. I want to thank all of you for showing up. So let's just get started. Now, give me a little bit of history. You're a dentist.
Yes.
All right, and I have to tell you, when we started looking for somebody to interview about this, you kept coming up, and I was a little surprised that a dentist would be somebody I would be interviewing about sleep problems or conditions in the body that cause headaches and migraines. Do you find that most people don't know that a dentist is a person, obviously in this case, that can help you with those issues?
Many people don't know. That is true.
Let's start with TMJ, okay? TMJ is a dysfunction of the jaw joint. Now, it's my understanding that you started treating this
30 years ago.
30 years ago. And the TMJ, tell me a little bit about what happens. I know we have a young lady here who's had some issues with it. Just tell me a little bit about that dysfunction real quick and why it causes the issues.
The TMJ is the jaw joint itself, and it's not a disease. Everybody's got one. In fact, we have two of them. The disease is when the muscles put uneven pressure around them, or the disc falls out of place, or various other problems could occur. And so there are roughly 25 diseases that make up the category temporomandibular disorder.
Now, when you were explaining to me that through the back of that joint, right between, you said right between my ear canal and my jaw, if I put my fingers there and open and close, I can feel that bone move.
Yes.
And right in that little spacing there runs blood vessels, nerves, a variety of important functioning parts of the body. And if that is moving just, you said a millimeter or two off, if the muscle's closing just a little too soon, that it causes pressure on those blood vessels and nerves, it can lead to a variety of items.
Yes, absolutely true. You're a good, quick take on this. And the fact is that it's a very sensitive joint, and it's compensate. Head posture can change, and chewing can change.
Well, so I had the pleasure of meeting a couple of your patients, and obviously we're going to talk to one today, who had been to, I don't remember names, but places that specialize in just treating headaches, hormone replacement, that they'd had headaches for years and they never understood why. Maybe they were tired, whatever they were told. Do you see a lot of patients that have suffered from headaches or neck pains or back pains for years?
Yes. The most important function of the back and neck in a human being is to support the head in upright posture. We, as humans, walk upright, and the micropositioners of the head on the spinal column are the masticatory muscles and the teeth. So this is very important stuff, and often overlooked in the medical profession.
Do people, when they come and see you, because I know a lot of doctors in town refer you patients, especially headache patients, when they come and see you, are they surprised? I mean, and I'm going to ask if it's okay if we can just talk to you real quick. You told me you had been to other doctors for years.
Several doctors.
Had headaches?
Headaches, back pain. I was just miserable. Couldn't sleep. I had to prop myself up with pillows at night, and I was just miserable.
And now you came to see Dr. Moses on the recommendation of your...
Of a friend, someone I knew in Ohio, and said, you have to go see Dr. Moses in Chicago. I was living just south of Chicago at the time, and so about 2 years ago, I I was experiencing pain that just would not go away. I've had TMJ for about 15 years. It would come and go, and 2 years ago the pain would just not go away. So they said, you got to go see Dr. Moses, and I went to Dr. Moses, and in 5 minutes he diagnosed what my issue was.
Now, did you know, you referred to it now as TMJ, did you realize when you were having the pain that that's what you had, or did you just know you had?
I did realize I had TMJ, and so when I would go to different doctors, we were all talking about my TMJ, and they gave me bite plates, and we went through different exercises, but nothing, it would keep coming back, and I couldn't get rid of it, and then we discovered that my bite plate was wrong, and in 5 minutes, that's where Dr. Moses...
You only wear something at night?
Only at night. Only at night, to bring my jaw forward.
And your headaches, neck pain?
No headaches, no neck pain, no arm pain, and within 2 weeks, I was back to a normal life.
I would question you, but you smile so much when you talk about it, it's obviously changed your life.
He's my miracle man. I'd gone to a lot of different people, and nobody, and I had a bite plate, and they're saying, well, you're grinding your teeth at night, and this is happening, and it's during periods of stress. Well, when it wouldn't go away, I knew I had to find somebody to help me finally deal with this, and when Dr. Moses, within 5 minutes, looked at my case and looked at my jaw and said, well, this is what you're doing, and he understood what I was doing and was able to fix it with a pacivator. So.
What is your success rate? Odds are people come in, they have the issue. Now, you told me everybody that comes in doesn't always necessarily have that, but you're able to screen.
Yes, but the correct diagnosis is very important. When you have the correct diagnosis, the treatment falls in place very nicely.
Okay. You started with TMJ 30 years ago, you said.
Yes.
And then you have morphed into now, I don't want to say more, but you've advanced into sleep issues.
Yes.
Which is another thing that and obviously your level of expertise in the sleep industry, you're one of the few people on the face of the planet I know that actually have an FDA-approved appliance that you personally designed. How did you get from, was it just a natural progression to go from TMJ to sleep?
It is a natural progression, but I was offered a position at Rush Medical School on the faculty, and I jumped at it because it's just personal growth. And when I went to Rush, they said, Alan, how are you going to prove to us that this oral appliance is working? All these patients are walking out here very happy with CPAP. How are you going to show us that this works? So I got a testing device, and it's a home sleep testing unit, and we agreed that this was okay to use and it was appropriate to use. And I figured I better take this home and test it on myself to see how comfortable or uncomfortable it is. Guess what? I had severe apnea.
You personally?
I personally.
Didn't know it?
I didn't know it. I didn't have any of the signs and symptoms. I didn't have high blood pressure. Sleeping well. I wasn't snoring. Life was good. And I had apnea. So I wanted to make sure that I really had the apnea. I went into the sleep center, and we negotiated. Because I'm faculty. It was 2 hours baseline study at the hospital at the university, and 2 hours with my appliance, and then if the appliance wasn't working, it was 4 hours on CPAP. Those 4 hours on CPAP, because my appliance at the time wasn't working.
Now this isn't the appliance you designed?
No, not
okay.
the appliance. Well, those 4 hours were the worst 4 hours of my life. They kept saying, Dr. Moses, your mouth breathing, and they had nasal pillows in. I can't shut my mouth because I couldn't handle the feeling. Well, we have to have your mouth closed, and they velcroed my hood closed, and I was like, when I woke up, that was the worst headache I ever had. So I went home and I said, I better come up with a better device than this. And I tried device after device. I made about 6 devices that were on the market, and none of them were working, so I felt, well,
now, I want to, if we can, for just a moment, I don't mean to stop you right at that point. I'm one of my devices, but these are a wide variety of devices.
Yes.
And we're going to get to your device in a moment, but you showed me some of these. This one literally locks your mouth closed. You can't open your mouth and you can't close your lips because that's sticking out the end.
Yes.
Okay. This one, of all of them, I have to think was my personal favorite. This one you bit down into and it sucked your tongue.
You push your tongue in there and suck.
And then
creates
you
a suction. Pull your tongue forward.
In the medical world, if I go to a sleep center and my doctor sends me to the sleep center, odds are I'm going to end up with this, right? This is what you wore. This is a CPAP. Considered the gold standard, I understand.